Hi there everyone, it's Ryan Liberty. In this video I'm going to answer the question, what is cyclothymic disorder? Alright, we're going to get to what cyclothymic disorder is, but before I do, I just have to say that this is not diagnostic criteria for cyclothymic disorder. If you need a diagnosis, you're going to have to see a licensed professional to get that anyway. This is just a small description to give you an idea of what cyclothymic disorder is. And if the label of cyclothymic disorder bothers you in any way, if it doesn't help you to heal, if the stigma around it or something just doesn't rub you the right way, you don't have to use the label. It's just here to point you towards something that may be happening in your life or the life of a loved one. So that out of the way, what is cyclothymic disorder? I've got my notes down here as always to make sure I'm giving you good information. And what is it? So cyclothymic disorder is a period or numerous periods of symptoms of hypomanic episodes and major depressive episodes that alternate back and forth, and neither of those episodes actually meets the full criteria for a hypomanic or a major depressive episode. This has to happen for a period of at least 2 years. If it's a child or an adolescent, at least 1 year. And during that period, there can't be a break of more than 2 months where the symptoms aren't showing. And for that 2-year period or 1 year period, if it's a child or an adolescent, it has to be happening for at least half of that time. So a significant amount of time to talk about cyclothymic disorder. Now, the criteria for manic or hypomanic or major depressive episodes can never have been met. Otherwise, we're not talking about cyclothymic disorder. And this is not something better explained by schizoaffective disorder, schizophrenia, schizophreniform disorder, delusional disorder, other specified or unspecified schizophrenia spectrum, or other psychotic disorders. None of those, if we're talking about those are the disorders, not cyclothymic disorder. And then it's not something that's happening due to the use of a substance or a medical condition like hypothyroidism. But this is something that interferes with your everyday life functioning. You know, you have trouble in your workplace, in your relationships, in your romantic relationships, those kinds of things. So there is one specifier for cyclothymic disorder, and that is with anxious distress. And what that means is you have to have at least 2 of these to qualify for the with anxious distress specifier. So 2 of the following: tense feelings, restless feelings, trouble concentrating because of worry, fear that something awful is going to happen, or feeling like you might lose control of yourself. And when you have with anxious distress, it could be mild, moderate, or severe, which is really just the number of those symptoms that are present. And it indicates a longer duration of symptoms, a higher suicide risk, and a greater likelihood of treatment non-response. So this is why we have this specifier to take note and to take it, seriously, or as seriously as we need to in the moment. So there is treatment for cyclothymic disorder, and we have cognitive behavioral therapy, psychodynamic therapy, family therapy, and of course medication. You'll want to go in and see a professional who will be able to put together a treatment plan for you. And I noted down that when you have cyclothymic disorder, there's a significant risk of up to 50% risk of developing bipolar 1 or bipolar 2 disorder. So what does it feel like for a person who has cyclothymic disorder? So in your body, this is going to depend on whether you're in that depressive state or that hypomanic state. But if you're in that depressive state, you may find that you have hypersomnia, insomnia, a change in your weight or appetite, some fatigue, anxiety symptoms, aches and pains, things like that. If you're in a more hypomanic state, then there may be some increased energy. You may feel fidgety. You may feel like you don't need as much sleep. You feel like rejuvenated even though you didn't get a lot of sleep than you normally would. You may feel like a little bit more sex drive than normal. As far as what you're thinking when you have cyclothymic disorder, or what's going on in your brain, when you're in a depressive state, you're going to have trouble thinking and concentrating, trouble making decisions. You may have thoughts about death, suicidal ideation, inappropriate self-blame, and you may just have difficulty recalling things in general. When you're in a more hypomanic state, you're going to have racing thoughts and ideas, those flight of ideas we call it sometimes. You may be more easily distracted, or you may deny needing treatment if somebody points out to you that you're hypomanic. When you're when you have cyclothymic disorder, emotionally in that depressive state, you're going to feel some anhedonia, maybe alexithymia, intense sadness, melancholy. If you're a child, you may show up as irritability or anger, guilt, low self-esteem and self-worth, hopelessness. If you're in a more hypomanic state, then you're going to have some grandiosity, possibly some grandiose delusions, higher self-esteem, cheerful. You may feel on top of the world or like you're high. It may also come with some irritability, and you may become a little hostile when you're challenged. Now, behaviorally in that depressive state, you may withdraw socially, you may have outbursts, you may neglect pleasurable activities, you may have less interest in sex and less desire overall for things, trouble sitting still, you may find that you pick at things, you may have slowed reactions to things and slowed speech. You may have poor performance in school and work, and you may prepare for or attempt suicide. And then when you're in a hypomanic state, you may feel a little bit impulsive. You may feel like you need to talk. You start conversations with strangers. You may speak loudly and dramatically, switch topics very quickly, and refuse to be interrupted by anybody. There's going to be more behavior directed at achieving goals and maybe starting a lot of new projects all at once. You're very excited about them. More engagement in activities that will result in pain for yourself. So overspending on shopping sprees or making poor investment choices, having many sexual partners, risky sexual behavior, that kind of thing. So that is cyclothymic disorder. I hope I've given you a nice, well-rounded perspective on what it is. If you have experience with it yourself, or if you know somebody else who's been suffering from cyclothymic disorder, I'd love to hear about it. So please leave it in the comments below. And I thank you for joining me today to learn about it. Hey, it's Ryan Liberty. If you liked that video, please give it a thumbs up, share with a friend, and leave any questions or comments down below because that would really help me out. If you're somebody who's gone through a traumatic event and you're feeling cut off from the people around you, I have a free course that will help with that, so please click to get it. And if you'd like to see the rest of my videos, please click subscribe. As always, I want to remind you that your life matters. Nobody can question your worth. However it is that you're feeling, whatever it is that you're going through, it's okay, and you are loved. Thanks again for watching.